4 minutes after 11 o'clock, the Dr. Payne Show is here. Lines, look at that, already open, magically, ready for you. 416-870-6400, star 640 on cell. What
Soon
is happening,
to change,
brother?
Dr. Payne.
That's right.
Yeah, I'm working with Chorus right now, new name and all.
Nice.
Probably the Pinpoint Health Show. Just name it right after the brand.
Why not?
Yeah, make it easy for everyone to understand.
Love it, buddy. What's going on?
Yeah, same old, you know. So what are we talking about this week? So a couple things that I really want to speak about this week is, so obviously one of the biggest services that we provide is the physio, chiro, massage, orthotics, like the rehabilitation centers. And, you know, I had a person this week and they listened to the show a lot and they were in to see me for an issue and I had recommended therapy. And every time I recommend therapy, I basically give the same spiel that I do, which is, you know, these are the places that I own and operate and can control the quality of care.
Right.
Here are the providers that I trust that I don't own and operate, but are people that I trust. And alternatively, you can go anywhere you want. I can't force anybody to go anywhere. That's not what I'm trying to do. And I give those three options to everybody. Mm-hmm. And this person had an interesting question for me. And I don't think they meant it in a bad way. It was more one of those things like, hey, have you ever thought about this? And they said, well, why should we choose your places over any other place? And I said, well, you know, that's a good question. And so I thought, and I gave sort of an answer to the person, but I thought about it after and I was like, you know, really, what is the advantage? Like, I can definitely vouch for the quality of care when it comes to the rehabilitation services. But then I started doing some other investigating in some other brands that exist. And I'm not going to talk about the brands or anything like that. But there's some very interesting things that I found. Number one, some brands are not owned and operated by a healthcare professional at all. Like it's someone who's just usually a business person. Yeah. And so you have to stop and think, what is the main objective there? Right? Like, I'm not going to sit here and say that the objective of my businesses is not to make money. Of course, it is also to generate revenue and pay people and create create a business. But I'm a healthcare professional, which means I'm held to a different standard, which means when you're looking at it from a legal perspective, you know, if you go buy a pair of shoes, the law will look at that as buyer beware. It's your own business to do your research. You might get ripped off. There might be a better deal, but hey, that's your own business. When it comes to healthcare, the rule is buyer have faith. So you should never go somewhere or deal with a healthcare professional thinking that you might be getting, a bad deal or something like that. So number one, I'm bound by that legally, that it is that buyers have to have faith in what I'm selling to them, which someone who's just a business person doesn't have to do that because, again, that falls back to if you were selling shoes or clothing or anything else. Healthcare is the only thing where it's buyer have faith. Everything else is buyer beware because it's a capitalist society.
Free market.
Yeah, it's a free market. But healthcare in the legal eyes is looked at differently. So that's number one. So I've seen that where the owners of the brands are not healthcare professionals. I've also seen brands that are owned by healthcare professionals, the big brand, but then have franchises, and those franchisees can be anybody. Doesn't need to be a healthcare professional. And I actually was speaking with a colleague of mine who's a pharmacist about, again, another brand, and that in his pharmacy, he had this rehab brand, and it was owned and operated. That one person was an engineer, the other person was a teacher, and something else. So there were like three owners, none of which were healthcare professionals. And I just thought, okay, so that's, I think, a big reason why Pinpoint Health has an advantage over everybody else. This is owned and operated by me. I'm a healthcare professional. I'm held to a certain standard. I also am accountable here on the radio. That's the other thing, right? Like anybody at any point could call this radio show and we can't really stop them from saying what they're going to say because we don't know. So if someone's ever been really unhappy with any of the services, there's an accountability. There's a platform where these people can make that known. Also, with being an accountable show, we have Google reviews, social media, all those things.
Of course.
You can make it very easily known on those things. And I've seen a lot of places that don't even have websites, don't have any Google pages, so that way they don't have to do that stuff. Then I mean, for years I've known that there's people in the industry. Who was telling me this the other day? A lawyer who deals with some of these things was saying that there were times that he would deal with certain clinics where they would go in and they were doing some work, and essentially there's like a sign-up sheet at the front, and it's people that are involved in like car accidents, WSIB, and there's just signatures there just to show that someone was here, but the place is empty. He said one He said one clinic that he went into, the rehab area was all moved out of the way, and there were like 6 couches with a big, massive, big screen TV set up. So I guess they were using it as like some place where they could just watch games and things like that. And I'm just like, wow, people actually go to these things, you know? And I want people to understand, because I know there are clinics out there and people out there that, you know the inherent value of what these things are worth. So as an example, if you're involved in a motor vehicle accident in Ontario, you are eligible, everybody, for a minimum of $3,500 of care, minimum. What that means is there's a lot of places out there that know that. There's also a lot of people that know that, and these places are saying, "Hey, why don't you come get your rehab with us? And out of that $3,500, I'll give you $1,000." Yep. Right, and you have to understand, if you're the person on the other end, you guys are, that is criminal activity.
Yeah, it's fraud.
It's fraud. You're conducting insurance fraud. So this doesn't just fall on the clinics where the person who is the policyholder say, "Well, I don't know, the clinic told me that." No, you know full well, I don't care who you are, that if you're getting money back, a kickback for your treatment, that is illegal. Yeah. And come on, but it's incredible.
Really?
Yeah, really, yeah, exactly. And so so this is where, when people are coming to see me, why I recommend either the places that I own and operate or the providers that I trust, because there's a lot of places that I don't trust, and I don't want people to fall into these things. And there's so many bad things, and most importantly, you're not going to get the care you need, and you're not going to get better. That's simple, amongst all the other bad stuff we just talked about.
Yeah. It's unusual to get health care and make money. As it's okay, it doesn't
oh man, if I when I think, do we have to take a break yet? Yeah. Okay, so I'll tell you a story when we come back.
We'll do that.
Something that happened with me.
Stick around for it, and your phone calls as well. You have pain, health concerns, bring them on. This is your hour, as you know. 416-870-6400 star 640 on sale. Dr. Payne Show, Global News Radio. 11:13 is the time. Up until noon, you have to call in with your concerns about your health. 416-870-6400 star 640 on sale.
Yeah, I'm angry. When I think about this stuff, I don't talk a lot about it on the radio,
right?
But I know that this stuff happens every day all over the place, and it gives everybody in this field a very bad name, which is why I do what I do, so that way we can change that. And I mean, even with like personal injury lawyers, and there's an important thing about going to good people. Like, we've had Savan on this show multiple times, and he's had me on his show, and he obviously also has his own show here, and that's a good firm. But there's a lot of bad lawyers out there, personal injury lawyers, that are also shopping people's cases around, right? Yep. Where they know that this is worth something. They're shopping it around. I once upon a time had, and I will not use any names, but I remember we were at a function and someone introduced me to a personal injury lawyer. Had a small practice, sat there. He said, we had a very casual conversation. Are you interested in any referrals of patients? And I said, well, we're always interested in, it seemed very low level. And so it sort of ended that way. This was on a Saturday. Monday, when I was back in the office, somebody showed up that was a tow truck driver, just out of nowhere, was like, so-and-so spoke with you. Do we have a deal? And I was like,
do we have a deal?
Yeah, it was honestly the most awkward thing I'd ever, and I did not know what he was talking about. And I was like, what are you talking about? He's like, so-and-so sent me. And I was like, oh, he didn't tell me that anybody was coming. This guy left, right? That lawyer calls me literally 15 minutes later, says, hey, when so-and-so comes back in, just say that you agree and we're all good. I said, excuse me, I need to understand what this is. He's like, well, the driver will bring in people hurt in accidents. You have to give him $1,000 right away.
Come on.
Then there's $2,500 left that you and I split. And I was like, no, you could tell your person to stay wherever you want. I was like, that's not what I had. I work with a lot, like with Savan and other personal injury lawyers, where it's just, if I know somebody needs legal representation, I refer them, not with any intention of me getting anything back, just simply they need that. And equally so, there's lawyers that if a person needs good care and they live within a certain distance of one of our clinics, they send it to us. That is the appropriate way to make a referral. But again, it also goes back to when I suggest to someone, hey, you can go see Savan, but you can also go see anybody that you want. I don't force them. I just sort of give it as an option, which I'm sure is what good lawyers would do in reciprocation with a clinic. So, I mean, if you're involved in any of this stuff and nobody can say, oh, I didn't know it was wrong. Like, it's wrong. If you're doing this stuff, you shouldn't be doing it. It's fraud. It's criminal activity. And most of all, you're just not going to get better.
Yeah.
That's all there is.
That's key, right?
Yeah, like you're
How
not
about your care?
Yeah, like don't you just want to be better? You're going to deal with chronic pain. And I'll tell you, we can have, there's been so many people that I've seen, and I've said this a million times, that were high functioning people and have sustained chronic pain, and it's ruined their lives. I saw a few people this week in that same boat, and every time it breaks my heart. And every time, not every time, but a lot of the time, there's this secondary gain that's involved where the people don't even realize that all they're doing is creating harm in themselves.
Yeah, shifty business. You know where chronic pain really hurts? In jail. It's never good there as well. Hey, Fernando, how are you? Good morning.
Good morning. I just wonder if you know anything about Harrington rod scoliosis. I had severe pain the past month. Apparently, I went to the hospital 5 times. I thought it was my pinched nerve, which I do have on my lower back, which I feel running the side of my leg. But the problem is the numbness. Ever since I was doing some stretching for my sciatica, it went away. But I felt something like a sprain or a tear running down my left side, and ever since that, I got numbness on my legs and now tingling all over my body.
Okay, so Fernando, let's stop for 1 second. You had this scoliosis from childhood?
Yeah.
How old are you?
I was 13 when I got surgery.
For the Harrington rods. Okay.
Yeah.
How old are you now?
I'm 39.
Okay. And so I'm assuming you continue to follow up with somebody about the scoliosis, or no?
Not as much, but
Okay.
I never really had the back problems. I was able to drive and do everything. Now I'm just...
Okay, so number one, let's start from the beginning. In order for Harrington rods, which is a surgical intervention to straighten out a scoliosis, to be considered, typically those curves need to be greater than, say, 25 to 30 degrees, which is very, very significant. Then, again, going in and doing surgery to the spine by putting Harrington rods in is something that is not a long-term solution. That's not going to mean that it'll solve the structure problem, but it won't solve that you potentially can have pain down the line, such as you have right now, because that area of your spine now over the last 20 years, even a little bit more, has been degenerating. As those things degenerate, you start to build up osteophytes. Those osteophytes can be putting pressure on nerves. And so a big component, and this is sort of why I always tell people that they need to be working with a professional. It's not enough to just get surgery and then wait till one day when you're 39 and you have these issues. Somewhere in between, you should have been working with someone on rehabilitation, keeping an eye on it. Is there any degeneration forming? What's it like? So it's, to me, what you're saying is not surprising, number one.
Yeah.
Of course, you would succumb to this type of pain syndrome after having that type of surgery. And it really just depends on the things that you're doing. You may also be doing things that are aggravating you, because if you're not working with a professional and you're not sure, then people often tend to do that, where they'll, I had somebody come in this week that was saying that they had a problem with their neck, and they watched some videos on YouTube and they started doing some exercises. And guess what? Once I figured out the problem, those exercises were aggravating the problem. And that's why you should be working with professionals, because we know the anatomy, we know the pathophysiology, we know what is good and what is bad. And leaving it up to yourself is often not the best thing. So I think at this point, you probably should come see me. We assess what's going on. We take some images of the spine to assess the degeneration, do a neurological exam, and sort of see where you're at. And then we can sort of decide what's the management from that point.
Yeah, because they're getting me a Kensington-trained rehab, and they say it's going to go away to strain on my lower back between my tailbone and my disc, somewhere there, and I can feel it tingling and throbbing.
So sorry, who's doing what? I'm confused.
When I went to the hospital to get my diagnosis,
Yep.
and they say it's a strain on my lower back.
Mm-hmm.
And that it's going to heal, and that the nerve pain will go away, and I have
Where was your scoliosis? In the lower back or the thoracic spine?
Yeah, the thoracic spine.
Yeah, so you can have thoracic spine issues. If you have pressure on the spinal cord, that can create sciatic type symptoms. Did anybody check like your reflexes and do a neurological exam on you?
Yeah, and I have an appointment with a neurosurgeon.
Yeah, so there you go. Yeah, so if you have nobody's referring you to a neurosurgeon, if exercises are the answer, you need to come see me. We need to look at it, and I can give you a better idea of what's going on and sort of what the long-term play is on that.
info@paincarecanada.com. Fernando, or 1-855-55-Dr. Lou, DRLOU. Your phone calls, lines are open. 416-870-6400, star 640 on sale. Your health and pain concerns, bring them on. Dr. Payne Show, Global News Radio. More of the Dr. Payne Show, soon to be Pinpoint Health. That's on the way. It's in the works. Same great service, new name. Same mug in studio every weekend, too. So I guess you're still going to be here.
Yeah, I guess they're keeping me around.
That's right. 416-870-6400, star 640 on cell to call in. Info@paincarecanada.com. You want to drop an email by. Let's talk about for a moment care that's designed for you. My sister-in-law, I guess over a year ago, came to see you. Mm-hmm. You fixed her up, got lots of good physio done. She's been diligent about the exercises she does. Still pain-free, still doing well. My wife has got sciatica.
Yeah.
Because that's a term everybody uses for back pain. It must be sciatica.
Yeah.
And so she came home the other day. She's like, can't we start giving me some exercise? I'm like,
No, yeah.
How do you know they're for you? And she asked me, am I doing these right? I go, A, I don't know. B, they're not yours.
Yeah.
But people do that, right?
Oh, my. I like, as I was driving in, I was listening to Greg speak to somebody, and he was saying, like, case studies, like, just because somebody says something about their car doesn't mean that it's the right car. It's the same thing with a diagnosis. Like, not all back pain is the same cause. There's, like, 100 different things that can cause the same type of constellation of symptoms. It's really about figuring out what is your problem. And also, not everybody's the exact same. You don't start everybody with the exact same exercises. Maybe they don't need exercises to start. There's so many different things. And I hate it. It's like the thing I hate the most, where people come in, and even when I was practicing more, people come in and say, like, I'm here for my low back pain because you saw my sister and you fixed her right up, one treatment. And so, I'm hoping you could do the same. And it's like, yeah, but I don't know that your sister's problem was the same problem that you had. And yours might take 3 weeks, 4 weeks. And then I always have that conversation, because if you don't, and you don't achieve what you achieved with that person, you're then just looked at as a failure.
DB,
it's like, this guy's screwed, like he's lying, blah, blah. It's not the same. Don't listen to other people about, I hear this all the time where it's, I got a sore throat. Oh, I had that. You know what it is? You got to do this for it.
Yeah.
No.
Easy.
No, that's not the way it works. Like, it just does not work that way. All you're doing is describing a subjective complaint, which is called a symptom. It is up to a professional then to take those symptoms, look for clinical signs, and put that picture together to form a diagnosis. A lot of symptoms coincide with a lot of different things. Like if you said fever, do you know how many things fever applies to? Right. A lot. There's a big spectrum, all the way from like a cold to stage 4 cancer.
Right.
So like you need to be very careful with listening to people who are not healthcare professionals.
Don't take other people's pills, man.
No, absolutely not. Absolutely not.
416-870-6400, star 640 on cell. Mikey, how are you, pal?
I'm good. How are you?
Good. What's going on with you?
Well, I've been to the doctor. I'm not sure if it's called bursitis or something. The sac that's at the side of the cheek on the side of the rear end there.
Okay.
And he says it's inflamed. He doesn't know why. But when I drive, my leg hurts and I can't lie on my right side. So what he's done is he's told me to eat 1 inch of turmeric per day.
Who's told you this?
My doctor.
Okay.
And to have, and he gave me anti-inflammatory, a pill a day, and to rub Voltaren on it.
Okay.
It's not really working.
Well, then, yeah. So it's a funny thing that I hear a lot. So my sort of one of my rules is that if it's a physical problem, it often needs a physical intervention first. Do chemical things happen later on? Yeah, maybe. When it comes to natural things like turmeric, which is good for an inflammatory perspective, or even glucosamine. I had somebody this week, same thing. We were talking about their knee osteoarthritis and that they wanted to start taking glucosamine. And it's like they said they took it after a month, it wasn't helping. It's like, that's not what glucosamine does. It's supposed to sort of help maintain the cartilage long term. So I often tell people when they're in my office and they have osteoarthritis of their knee and they want to start taking glucosamine, I'm like, do you have kids? Yes, tell them to take glucosamine, because it's really good if you take it over a long period, same as turmeric. But there's so many other things that contribute to inflammation. But in acute scenarios, these natural things are often not as effective as people want to believe. And more so than that, like there's very few physical things that I can think of when they're acute and they just happen that shouldn't be dealt with from a physical perspective. So when you have a physical problem, there needs to be a physical intervention as the first line of defense. And so to be taking pills, rubbing cream, taking turmeric is the wrong stuff to be doing. You need to get in to see somebody that can actually work with that hip or wherever you said the pain is, and really start to look for the functional perspective that's causing the inflammation. I had a person this week, here's a perfect example. Older man developed swelling around his knee, and he was 67 or 68. I thought for sure knee osteoarthritis. Like just based on the age, the quick symptoms that I read, brought him in, took a look at him. I spoke with him, didn't have any consistent symptoms of knee osteoarthritis. So I was like, okay, this doesn't sound like it. Then I examined him. With knee osteoarthritis of a knee, you can, especially when it's bad, I don't even need to see an x-ray. I can look at the knee and just see how big the bone has gotten. And that tells me, I looked at this guy's knees. They were better than mine. And I'm half his age. And I was like, okay, this doesn't seem like it. Still sent him for an x-ray anyways, just to make sure. No osteoarthritis whatsoever. Ultrasound, he has bursitis of his knee. Okay, of the subpatellar bursa, okay? And so then I started thinking, well, hang on a sec. Why do you all of a sudden develop... So a bursa is designed as an area of padding between often soft tissue and a bone. Because if you didn't have that, then that tendon would rub against the bone. And, the same thing is like rope rubbing against a piece of wood. It'll snap eventually. Yep. And so that's why these bursas... And I was like, well, why... After all of these years, would you sort of start to develop a bursitis? And I said to him, when, this started about 6 months ago, did you do anything different? Did you start a new walking program? He said, no, everything has been the same. I'm like, you've done nothing different in the lower half of your body. He goes, well, I did get a pair of orthotics. And I said, oh, that's interesting. I said, are you wearing them? He said, yes. I said, can I see them? He already has high arch feet, this gentleman, which is naturally a rigid foot. I saw these orthotics. They were made with such a high, stable arch that I was like, this is the complete wrong intervention for you. I was like, this is why you have bursitis. You've introduced something into your body that you don't need, and you're doing that. It's causing a functional thing where it's changing the force patterns in your body, and now all of a sudden, you're getting bursitis. Take these things out. He followed up with me 3 days later, said that he was pain-free.
Come on.
Yeah, just by taking it out. Yes, and so that's often the physical problems need a physical intervention.
So what do you suggest?
I suggest you come see me, Mike.
Okay.
Done. Thanks, Bill. Easy. 1-855-55 Lou, DRLOU. Info at paincarecanada.com. Have plenty of time for your calls as well. It's only 11:30. 416-870-6400 star 640 on sale. Dr. Payne Show, Global News Radio. It is 11:32. Dr. Payne Show. 1-855-55 Lou, DRLOU, info at paincarecanada.com, and that's going to be all changing soon. The show will still be here, of course, and you'll still be able to go see one of many clinics, but rebranding is what they call it.
But before we get on to the rebranding, because I really want to continue on that topic of a physical problem often needs a physical. So this is a big thing, even the new guidelines around pain management where, for so long there was the reason why we have an opioid crisis is because prior to the new age of thinking, the answer was, oh, you have a physical problem, here's a pain med. Yep. That is not the answer. The first line of defense now, and this is coming out amongst a ton of different guidelines, this isn't just me saying it, is there should be physical intervention first. You should be doing physio, chiro, massage, modality treatments, assistive devices before you start using anything. You might need it in conjunction. Some things like if someone throws out their back and they potentially herniated a disc, that requires a physical intervention, but it probably also requires a chemical intervention because you need to get their pain level down so that you can move them. So there are instances, for sure, but when I hear this all the time for sprains, strains, people are being given just, anti-inflammatories or being told to put a cream on it. No, that's not what you should be doing. You should be going somewhere and getting treatment. And anybody that's telling you otherwise is either misinformed or doesn't know what they're talking about. And that to me is a red flag. And it's something that is all too often happening. And it's the wrong management of these types of injuries. These injuries need to get treated. They need to be treated. And again, when you're making this referral, when walk-in family doctors are making these referrals to physios, chiros, these are people that about the musculoskeletal system, hands down, know more. And that's not me bashing family doctors or walk-in doctors. Their job is to know a lot about a lot of different things. If you went to your chiropractor and about, I don't know, your fever related to your pneumonia, they don't know nearly as much as that walk-in doctor. That's why different specialties exist. And so the right professional needs to be dealing with the problem. And if you have these things, the other thing is physios, chiros are primary care. Guess what? You don't even need to go to the family doctor or the walk-in clinic first if you have these problems. Go there first. If they think it's not something that's musculoskeletal and maybe being caused by something more serious, they will refer you.
Right.
And that's an important thing that would save the healthcare system all kinds of money if people could adopt that method.
It's amazing how for certain types of advice, people will naturally gravitate towards somewhere they should go, and in other places they won't. And the healthcare system is a perfect example. I've had this conversation with my father-in-law a million times about what I'm eating and my diet and the ketogenic. I lost all this weight and my blood pressure. It's all good because I just changed my diet and I got off my ass and started moving. Well, I always exercise, but I do more now. So we're talking about eggs. I go, I have 5 a day.
Yeah.
And I have it with my avocado and my salad, whatever. It's just, he's like, my doctor told me years ago, 1 egg a week. Yeah. I'm like, Jesus Christ. Honestly, the guy, that was in 1930. That's when the Titanic was still above water. That thinking with eggs and cholesterol
and
from your
things
GP.
are constantly changing. There's that commercial now when you're watching the Leaf games about Nylander gets some green shake or whatever, and then Doug Gilmour and the boys are over there and they're like, you guys don't carb load anymore, and they're eating a bunch. Stuff evolves. Yeah. Right? And eggs is a perfect example. Once upon a time, if you had high cholesterol, it was nope, never. You can never have an egg. Yeah. The amount of cholesterol.
It's not dietary cholesterol that does it.
And now it's something that we look at as a zero sum. It's have all the eggs you want. It really does not very much. There's not a lot of calories. It has to do more about when it comes to cholesterol, oftentimes it's more about the HDL levels where people are just inactive, which is why their LDL rises. Right. Now, there are some things, obviously, that you shouldn't be eating, but, when we're talking about eggs, that's probably not one of them. But people forget, and this isn't just a problem with the general public where they forget that things evolve, but some professionals graduated a long time ago, and they don't keep up with the newest, greatest, latest research.
Some do, but some don't.
Some do, yes. And you know what? Not only do some do, the vast majority do. Some do not. And some professionals don't evolve with the way our world is evolving. And they're still relying on the exact same things that they were using 40 years ago, that it's no, that doesn't work. And another example is bed rest for low back pain. Never, ever, ever the right answer. Never, ever. Or a neck brace for your neck. Not unless you have a fracture. I get people all the time that are like, oh, my doctor told me to go get a neck brace because, I sprained my trap muscle. I was like, no. The last thing you need is a neck brace for your sprained trap muscle. You put that on, you'll never move your neck again because you'll just decondition the hell out of it. And so, but again, this is a small proportion. The vast majority of people do keep up. But, it's important for people to also know what's up to date. So this is the fine line about when you use Google, you don't use Google to be your own doctor, but you use Google to be informed, so that when you're going, you're asking the right questions, but not that you're doing your own, diagnosis, prognosis, and management at home on Google, right? Because that's the wrong thing. But to use it so that you have a base understanding of what's going on, so that you can ask the right questions, absolutely nothing wrong with it. I think it's a great point in history that we're in, that we have these tools, and that the average person is so much more well informed. The other thing is also, a lot of times when I give people their information, although I spend a lot of time explaining things to them, for some people it's just overwhelming. They can't keep up. So I'll write stuff down and I'll say, go watch YouTube videos on this. You'll see a lot of information. You'll start to digest it. Maybe you're more of a visual learner and that will help, or whatever. Or you need to hear it multiple times. So it's a great resource to have, the internet. But you got to be careful about self-medicating as well.
My wife's the same way. Her doctor's close to retirement. She's panicking. She goes, how do you feel confident in your doctor? I said, my GP's younger than me. I love that. He's a younger dude. Yeah. Because it's a thinking. I'm panicking at my age. She'll be having, scopes every. He goes, how old are you? And he goes, relax, dude. Just settle down.
And I know there's a couple, Dr. Gordon, Dr. Bergava. These guys are all older than me. And they're up to date with all the newest, greatest stuff. It's just really about the person. And some people just don't keep up to date. And some people do. Number one, you have to, right? There's continuing education that's required, but the problem with continuing education, the way it's enforced, it's not like, the police is showing up if you haven't done it type of thing, right? It's sort of like a little slap on the wrist. It's like, hey, you better keep up type of thing.
We'll take a short one, 416-870-6400, star 640 on cell. Still got lots of time to call in with your concerns about pain or your health. Bring them on. That's why the show is on the air. Dr. Payne Show, Global News Radio. It is 11:42 on Saturday morning, 4:20. The first legal one ever.
That's true.
Yeah.
Yeah, that is
first
true.
Legal
I didn't
one.
even think of that.
Oh, yeah, yes, you did.
No, I didn't. I didn't even realize it was April 20th, in all honesty.
I know. Well, you can't tell by outside, right?
The rain's good, though. The trees are starting to come alive. Yeah, I think so.
Yeah,
I noticed it in the backyard when I looked out this morning.
I'd like to ride my bike, actually. Thank you very much. A little sunshine would be good.
Yeah, it's coming. When's it coming?
Because nobody needs exercise. That's not a vital component of the healthcare system.
No, absolutely
Getting
not.
off your ass and moving
exactly.
would be good.
So let's go through a bit of services, like the things that we offer. So we started with the rehabilitation, obviously, so the chiropractic, physiotherapy, massage therapy, osteopathy, acupuncture, all of those paramedical services, I guess let's call them. We also offer specialist services like sports medicine doctors, orthopedic surgeons, physiatrists, people that can deal with the more serious things. And those people can deal, like, obviously, if it's a surgical intervention, it would be surgical. There's injections that are an option, things like PRP injections, which we haven't talked about in a while, but we definitely will, especially with knee osteoarthritis, and you want to delay that eventual operation, get that inflammation down. PRP injections are a wonderful thing. Pain management, like through the physiatrist, some people do need to be on constant pain medication. Then there's also the other psychosocial services, right? The cognitive behavior therapy through social workers and psychologists for people who need that as well for dealing with their pain management. The nutritional aspect of it. So we have dietitians and nutritionists that help tailor those programs. We also have people like naturopaths who focus on the natural side of things. Naturopaths, we have devices when devices are needed, so things like orthotics, custom braces, sometimes walkers as things get more
things
serious.
in the home too.
Yes,
right?
we also have people, specialized trainers, rehabilitation trainers that we can actually send to your house to work through programs with you on what you need to be doing at home. We offer for other this isn't really a general public thing, but things like independent medical assessments for people who have been hurt in car accidents or disability claims. And we work both on defense and plaintiff side, so we're not one-sided. So there's a whole host of different things that we offer. And the reason why we do it is because injury and pain management has usually multifaceted causes, so we use that same approach. And I don't have a list in front of me, so I probably haven't done it justice. There's probably a lot of things that I'm actually missing, but those are on a high level list of things that we offer to the general public. And of course, people who want to see me for my opinion, I'm happy to see people, give my second opinion, my assessments. And then typically what I'll do is I'll send them off to my team, my provider network, or if they need to go back somewhere else. And so, that's another thing. A lot of times when I see people, they're like, well, no, we want to see you. Believe me, if I have someone part of my team, it means that I think that they're better than me. Not even equal. Like, I've thought about this a lot. Like, do I hire people that are equal or better? And I think from a treatment perspective, I hire people that are better. And I wouldn't make those recommendations unless I was absolutely certain. Because again, when it comes down to it, there's a lot of accountability that I have. And anybody can call this show and tell me that I was wrong or I did something wrong, my team did something wrong. So we really try to provide the highest quality and standard of service. And we do it in what's called an evidence-influenced method, which is the right way to practice healthcare, which means what's the best scientific research around whatever the issue is, what's the clinician's experience, which is mine and my team's. I often will hold rounds about patient files in terms of like what I think multiple different professionals will think. And then also what the patient wants. And that's a very important thing, because although you can have the best scientific research, the best clinical experience, if a patient doesn't want to do something, then you can't do it. And we tailor those programs to what patients really want. And we make sure that they are part of the decision-making process for their healthcare goals and needs.
It's interesting you mentioned that whole team approach and doing the roundtable, because you mentioned sometimes, no specific places mentioned, but You've used this expression so many times on the show that if you have a hammer, everything becomes a nail. That's a scary thought.
See this every week. It's always people coming in saying, "Oh, I was going to go here, and they have this device, and they said that they could help me." It's like, well, yes, some of these specialized tools, of course, like we have a lot of these specialized tools, but it's part of our treatment. It's not it's not a standalone thing. It's not like, okay, you're just going to get this. Our approaches are very rarely ever, I very rarely sit there with the patient and say, here's the only thing that you have to do. It's usually like, here's everything that you need to do.
Yep.
And there's a lot of places out there where it's just a one-stop shop. There's one solution to every problem, and that's a big, big red flag. I'll also say, be careful of professionals who are not necessarily selling a product, but maybe their service, where they think they're the answer to every single problem. And that's a big red flag as well. And, I've heard of people that go see certain professionals and they're told, you stop taking this medication that you're on. Those are all red flags. Healthcare should really be about a team approach. If I see somebody and I think that they're doing something that's wrong because another professional has put them on it, I would never say stop doing that. I would say, you know what, I'd love to have a conversation with that person. If you're okay with it, I want to talk to them. I will respectfully talk to that healthcare professional and just get a sense of why. If I might be wrong. I might not see something that they're seeing. So why would I take the risk of telling someone, no, get off of that? It should be very much a team environment. Even if you don't know the other healthcare professionals that are involved in that person's care, we should all have a mutual respect for one another, and make sure that we're not just pushing someone's opinion off to the side without knowing the full intention. Because patients might also be doing a bad job of giving us the information.
Good point.
Oh, it's a big point, right? No. It's even like a lot of times people come in and say, yeah, I had an MRI and it showed this. And I'll say, can I see the MRI? Oh, I don't have it with me. Well, I put on my notes, I put a little asterisk next to that because that's what the patient said they had, but I don't know for sure.
Of course.
I'm not relying just on that. I need to see it. And that's not because I think patients are malicious. I think it's because humans can make mistakes. And I think it's important to see those documents and make sure because, again, due diligence is an important process.
416-870-6400, star 640 on cell. Taking a short break. Still got some time. You have any questions about your health, your pain, bring them on. 416-870-6400, star 640 on cell. Dr. Payne Show on Global News Radio. It is 11:51, so you got a few minutes left. Had close to an hour. Sometimes when you get in a cab, you got to catch a flight, and people running down the bridgeway. In the last 2 minutes before the plane takes off.
Every show, whether it's mine or someone else's, everyone remembers to call at the end. But anyways, let's get to them.
Hello, Bonnie.
Yes.
How are you?
I'm fine, thanks.
Great. What's going on with you?
I'm calling about my 4-year-old granddaughter. She was out with her mom and dad about a week and a half, 2 weeks ago at some reptilia place.
Okay.
She hurt her foot.
Mm-hmm.
I'm not exactly sure, just on one rock or something. They weren't rock climbing.
Yeah.
And I've been watching them for the last week and a half, and she's still limping, running on her toes. I took her to the walk-in clinic, and the doctor said it was a fractured heel.
Did they take an x-ray?
He said an x-ray wouldn't show anything. A CT scan was too much radiation for a 4-year-old.
So how could he or she have diagnosed the fracture?
Well, just by pushing on her heel. That's the only place she showed any pain at all.
Yeah. I'd say that's definitely the wrong thing.
Yeah. Should I take her in?
For the x-ray?
Yes.
Yes, absolutely. So the big thing to understand here about radiation is it's always a risk versus benefit. Number one, the radiation exposure to a heel in a little girl is not going to be very much. But the important thing is that kids have growth plates, and unlike adults, our growth plates are fused. When we see a fracture, the fracture is often in the bone or in the joint or whatever. The problem with kids is when those growth plates have a fracture within them. Those are very, very important to get diagnosed and treated properly because they can cause a lot of long-term problems. How long has it been since this happened?
It's been about a week and a half.
Yeah, so that's the other thing too. Like this is I might say at that point, if it's been a week and a half, most simple soft tissue injuries in a child that age would take like 4 to 6 weeks to heal. So you could also wait another few weeks, just see how it's going. And if it's not better then maybe get the x-ray. But I think if it's only been a week, it's still a little early.
Okay, then.
Okay.
Well, thank you very much.
No problem.
I just didn't know what to do.
Yep.
There you go. Thanks, Bonnie. Appreciate the call. Moving on to Kelly. Hi, Kelly.
Hi, it's Callie.
Callie, how are you?
I'm very good. Yourself?
Good. What's happening this morning?
Okay, I've been listening to your program for quite a while. It's excellent.
Thank you.
I have a problem with my hand. I had 4 falls last year. I'm taking an antidepressant called Wellbutrin, and I think I'm starting to have some balance problems, and my doctor and I haven't sort of sorted it out. But I had these falls, and after them, it would be in the late fall and up to today, I'm having a lot of pain in my right hand. A couple of the falls were forward, a couple were backward, and I think I've injured it in those falls. I can't use, I'm losing the use of the hand, basically. The thumb is swollen at the base. And
have you had an X-ray?
Yes, I have had an X-ray. They said it was normal. But the pain's not reducing. I get flashes of pain. I can't turn caps off of bottles. I can't lift things. I have trouble writing. My doctor, has decided, she hasn't given me a diagnosis really. She said, well, it might be arthritis, but it doesn't feel like an arthritis pain to me. I have it in different...
Well, arthritis would have showed up on the X-ray.
Yes, that's right. But anyway, she wants me to get a splint, thumb wrist splint. I just am wondering if it is something other than tendons or ligaments, and there's a hairline fracture or something like that. Are we taking the right action? I guess that's what I'm asking.
Are you taking? I don't think it's necessarily the wrong action in terms of what it could be. I don't know unless I take a look at it.
That's right.
I would, all the things that you've suggested are things that would be on my list of possibilities: fracture, sprain, strain, something inflammatory from a systemic cause. So I'd be interested. How old are you?
69. I just turned 60.
69.
A young 69.
Yeah, and so your hands, have you noticed bumps on the knuckles, things like that over the years that have formed?
No.
Okay. So, yeah, I mean, I'd have to look at the imaging. I'd have to sort of assess it. Maybe a splint is the answer. Sometimes it's just about resting that area. Mm-hmm. But, yeah, again, it's something that I see that you're in Etobicoke. I can see you at my main office, which is at Etobicoke General Hospital.
Yeah,
and
I've used that hospital for a number of things, like cardio therapy and whatever.
Good.
And I wanted also to see if you could have an assessment, you or one of your colleagues, on my back. I do have degenerative disc disease and arthritis, and I'm having problems. I'm on a walking program. I've just lost 58 pounds. And I need more to come off, but I think that there's some problems starting now. I'm having trouble with, any long, other than 10 minutes of walking.
Okay, yeah. So
both of those areas.
Yeah, no, we can absolutely, look at everything and assess all those areas. So, give me a call at the 1-855-55-Dr. Lou number, DRLOU, and then we can set up an appointment from there.
Okay, so it's 855-553-7568?
Yes.
Okay, it's very nice to talk to you.
Nice talking to you, too.
Thank you very much.
Thanks, Callie. Appreciate that. Again, do follow up with that number and info@paincarecanada.com.
You don't even know what they correspond for. John's sitting here when it's like, DRLOU. I don't know what it changes.
I'll just look on my keypad.
Yeah, no, but it is right. Yeah. It's funny. I looked at it the other day, which is the only reason why I know. I wonder what the actual number is.
And it's your number. Jerk.
But it was just funny that you nodded and that you were confused.
Yeah, good. All right. Tell them how they can reach you, how it works.
Yep. So that's the easiest way. 1-855-55-Dr. Lou, DRLOU. Check out Pinpoint Health.
Right.
Just type that in. You'll see a list of our locations. If you type that into Google, check out paincarecanada.com. Soon we'll be switching everything over to just Pinpoint, but as we transition, or reach me by email, info@paincarecanada.com.
Call them anytime. Get it happening. Get your pain resolved. At least get on the road. Back here next weekend for a special 2-hour show of the Dr. Payne Show on Global News Radio.